You're listening to the Modern Healthcare Back Office, a podcast dedicated to solving the billing issues and gridlock facing the healthcare industry, presented by Prochant, hosted by Chuck Ellis and Rachel Schools.
Hey there, folks. Chuck here, and welcome to the Modern Healthcare Back Office. This is a very special live episode of the Modern Healthcare Back Office, where we will be sitting down with Joey Graham, our Chief Sales Officer here at Prochant, and Ronda Buhrmester at the VGM Group. And today's topic is a very special one. That's why we wanted to do it live and have lots of opportunity for folks to ask questions. They will be addressed at the end of this episode. But today's topic is optimizing your HME intake team. It is something that we deal with every day here at Prochant, and a lot of folks at the VGM Group have to field these questions all the time, I'm sure. So I am going to turn it over to our experts now and let them get started. So without any further ado, please welcome Joey Graham and Ronda Buhrmester.
Thank you so much, Chuck. Very excited to be here. Thank you all for taking the time to attend our webinar today. And Chuck, if you wouldn't mind, go ahead and starting my video. It says the host has stopped it. So
okay,
on the video there.
Sure.
Thanks, guys, again for coming on and joining us today. We are very excited to be speaking to you. So I am joined by a very special guest today. Her name is Ronda Buhrmester, and she is with the VGM Group. I'm sure many of you know who Ronda is. We and Ronda do a lot of speaking together. We typically like to attend a lot of the trade shows around the country throughout the year. And we do a lot of different presentations together. This is one. So Ronda and I actually presented this last year at the VGM Heartland Conference, as well as a couple other smaller conferences. It got some really good attention, really good feedback. And so we felt it would be important to share it for a wider audience today. Okay, so what I'm going to do first, Ronda, is hand it over to you to just tell everyone a little bit about yourself.
Thank you for having me, Joey, and the Prochant team. I really appreciate being on the webinar today with all of you. I'm the Senior Director of Pay Relations and Reimbursement at BGM. I'm on my 10th year at BGM, doing that role where I help our supplier community out with a variety of questions in that billing reimbursement world. Prior to that, the hospital-based DME. So I've had my feet on the ground in the DME industry. So I get some of the pain points that you all have faced, and that's where some of these questions and things that we'll bring about to share with you all come from, is my experience with boots on the ground in the DME industry and also working with an array of suppliers in the community. So thank you for having me.
Absolutely. Thank you for being on with us, Ronda. A little bit about myself. As I mentioned, I am Joey Graham. I'm the Chief Revenue Officer at Prochant. I've actually been in the HME and pharmacy industries for over 20 years now. Right now with Prochant, we're focused on helping providers scale up, deal with more and more business with fewer and fewer resources. Also, we've got some really amazing technology offerings underway. My background is I actually came up through the ranks of a DME company. When I was right out of high school, I started working at a DME company as a warehouse technician. So I was filling oxygen tanks, I was servicing wheelchairs and building new equipment right out of the box. And so I learned the industry from the ground up, from actually being a delivery driver, taking 24-hour on-call, working with patients. That's my roots in this industry. And then over time, I grew into a revenue cycle role, first in customer service and intake, then in the billing and collections department, before I finally got my MBA and became the director of operations for a large regional provider. From there, I actually got picked up by Brightree, who made me a senior consultant. They put me on the road, and I traveled all over the country working with providers of all sizes and shapes and types, helping them not only with the software, but also with the overall workflow, the overall flow around reimbursement, inventory tracking, all that stuff. So solving business challenges, solving software challenges, helping providers implement the software. That's all the stuff I did at Brightree. From there, I actually moved on to one of their customers who brought me in as their VP of revenue cycle. And that's how I ended up working with Prochant. That company was acquired. And so Prochant was its outsourced billing partner. So I was a customer before I came and joined the company. Now I've been with Prochant for almost 8 years now. So it's been a great ride. We've done amazing things. We're on the Inc. 5000 list, the fastest growing companies. We're VGM's trusted partner for focused billing solutions. And we're the only RCM service provider to the HME industry that's high trust certified. which is HIPAA's gold standard. So your data is secure when you work with Prochant. So let's talk about our agenda for today. We're going to be talking about, first off, an overview of what we're talking about. We talk about intake, optimize your intake team. Let's all get on the same page with what do we mean when we talk about intake. Then we're going to talk about how we structure that team. How do we structure that team for success based on the type of provider that you are? Then we're going to really dive into the workflow and the systems that support that workflow. We're going to spend a lot of time talking about the interaction between the workflow and the systems. Then we're going to talk about, as I'm evaluating these things, what are some of the tough questions that I need to ask myself to make sure that I've handled all the what ifs, all the things that could happen, right? A lot of times when we build out a workflow, we tend to focus on the happy path, right? That's the path that is everything goes right and it follows this path. We're really good at building out those kind of workflows. But what if it doesn't go right? What if there's something special? It's an urgent discharge, or the medical record is not 100% clear, or whatever it is. How do we handle those situations, right? What are some of those tough questions we've got to ask ourselves and make sure that we've handled in our workflow? And then finally, we're going to just summarize with some next steps. Now, before we go further, I actually want to seed plant for you the answer to the question. The question being, how do I optimize my intake team for better success, right? How do I do that? The answer to that is, number one, you've got to structure your team for success. We're going to talk a little bit about structuring your team for success. Number two, you've got to get a grip on your workflow in those systems. You got to make sure you have a really strong workflow and that the systems are supporting the workflow, that it's really well understood how that all works. And then finally, we've got to make sure we ask those tough questions because, again, a lot of times when we map out a workflow, we map out the happy path. We've got to make sure that we've asked those tough questions so that we can handle the what ifs and the things that are going to happen. We know are going to happen every single day that are not going to necessarily be along that happy path. Okay. So that's how we optimize our intake team. And that's what we're going to be talking about today. Okay. So let's quick overview. Let's get on the same page with what is intake. Also sometimes called the front office. Intake includes your phone queue, your fax wrangling function, or whatever you call that seat that takes all the inbound faxes, all the inbound referrals, your intake and eligibility function, your documentation, chasing down those documents, determining is the documentation qualified, what else additional do we need, getting those prior authorizations, hopefully before we fill the order, and then finally getting that order moved on to be scheduled and dispatched. Okay. I'm going to talk about the functions of intake. These are the functions of intake. So when we do a functional structure, we're talking about this kind of structure. Okay. But that bottom line, the goal of intake is clean reimbursement, right? That's it. And I would guess that's why most of you signed up for this webinar. A lot of us have really come to that aha moment in managing reimbursement and managing revenue cycle, where we recognize that if we could just get it right up front, then we wouldn't need half the resources we do working the back office. By the way, front office versus back office, what front office means is everything that happens before you fill the order. Back office is everything that happens after you fill the order. So that's when we talk about front office versus back office revenue cycle. Front office revenue cycle is generally your intake team. It's all that stuff we're doing before we roll a truck or provide our product or service to our patient. And then that back office, everything that happens afterwards, getting that billing out the door, posting the cash, working the held revenue, working the AR, working the denials. That's all back office. That all happens after the fact, right? So today is all about front office, all about what do we do to make sure that we've got a clean order that's going to go to our reimbursement team and hopefully get paid the first time we submit a claim. Okay. So now, structure of intake. How do we structure this team for success? Before we jump too far into structure, the prequel to this that we're not talking about today, but we certainly could, is hiring the right people, making sure you've got the right people on the bus, right? That's a whole other topic. There's a lot of things that you could talk about. How do we get the right people in our company? A couple things I would say just offhand. Number one, make sure that you're hiring based on your core values. You can always train skills. You can't train attitude. I think we all know that, right? So finding the right cultural fit for your company, even if that person isn't a DME expert, a Brightree expert, or fill in the blank expert, we can train that expertise, but we can't train the attitude. We can't train the work ethic, right? That's the stuff that comes with it, that we have to make sure that's the right person. So making sure you're really hiring based on those core values is super critical. And I will tell you, here at Prochant, we leverage a system for hiring called the WHO method. There's a book, it's called Who, and it's about hiring the right people. It talks about all the different interviews and stuff. And so if you want to research that, write that down. That's a great method we found for finding A players, for finding those really good people that are a great cultural fit that we can bring in, and we feel confident we can train them and make them really talented in whatever area we put them in. Okay, so now structure of intake. When we start out in this business and we have a smaller provider that we're working with, generally we may have just one team, and we may call that team customer service, right? Sometimes there's one branch, one team of customer service reps, and they just do everything. They call soup to nuts, right? They take it all the way from answering the phone, grabbing the fax off the machine, through entering the order, entering the patient, checking the eligibility, getting the prior authorization, scheduling the patient, calling the patient, collecting the money, all that stuff. It's just one team. It's just one person, because we're not yet big enough where it makes sense to have a larger team. But as we grow, it does make sense to have a larger team. And that's when structure becomes something we really got to think through. What's the right structure for my intake team? Unfortunately, there's no silver bullet answer to this particular question. The answer is it depends on your payer and product mix, as well as your geographic reach. Those are the things that it depends on when you're determining, how do I structure my team for success? So for example, let's say that you are a provider who is very heavy in Medicaid. Maybe your local Medicaid, you do a lot of incontinence for Medicaid. So it might make sense for you to have a Medicaid incontinence team, right? Maybe that's half your order volume, or 40% of your order volume, or these orders, very specialized. I can have a team of people that just do nothing but focus on that. And then I can have my secondary team handle the rest of the orders. In that same vein of thought, you really have to look at your business and where are those large buckets of orders that are coming in? Is it a certain payer? Is it a certain product line? Maybe you're very heavy in sleep. You have very heavy sleep division. So you're going to have a sleep focused team for intake, and then you'll have a team that handles other stuff, maybe a regular DME, bent metal type team, and your respiratory team. So you really look at your business and figure out where those volumes are. What you're looking to do is create teams that are of similar size, but are large enough that you can, within that team, specialize people a little bit. So that if I have, let's say, a team of 5 people processing my CPAP intake, then I can take 2 of those people and have them focus on Medicare. And then I can take another person and they're going to focus on Medicaid. And the other 2 are going to focus on the rest of the commercial payers. So that's how you want to kind of look at structuring that team. One thing I'll say is we try never to make a team that's fewer than 3 people. Why? Because somebody's always out, somebody's always sick, something's always going on, and I don't have a backup, especially when I have a team of 1. A team of 1 is a disastrous scenario. I think we all know that, right? Team of 1 is a disastrous scenario because there's no backup. If that person's out, then I don't know who's going to do it, right? Now the owner's in there processing orders and answering the phone because the one customer service rep isn't there, or the one person who knows aid incontinence for this state is gone. Something happened. They went down the street for $1 more an hour, whatever it is that happened. And now I'm at risk. So making sure I have a decent sized team so that I can cross train those people within that little pod to be each other's backup, but still maybe have them specialize a little bit so that on those days when they're all there, they can do that. So hopefully that makes sense. Again, not a silver bullet answer, but in general, when you are organizing your intake team, you may have multiple layers of sorting. That first layer is generally going to split by either function, branch or territory, or payer product. So one of those 3 elements is where you're going to typically have that first break of how do I break down my intake team. A large company is typically split up by function. There's a large central intake division that even may be geographically spread out, but within that division, those different workflow steps that we talked about, answering the phones, working the prior auths, getting the eligibilities, those are all separate teams of people who within those teams, they're big enough that they can then specialize by payer and product based on the needs of the business. So get that team structured for success. Now let's change gears a little bit and talk about the workflow itself. So this is the sort of high level intake workflow that the vast majority of HME providers follow. It starts there with your phone queue, your walk-ins. coming into your showroom, walking into your store, or that phone system that just rings off the hook all day long with people calling in for any number of reasons, right? So there's managing that. Then there's your fax wrangling function, so fax wrangling to us means this is like the aircraft controller for the aircraft controller for your incoming referrals. You've got all these faxes coming in. You might have multiple fax lines. You've also got e-referrals. You've got other things coming in. This is the person who's sort of making sense of it all. Like, this is a Chinese menu. I've got to throw that away. This is an authorization that was requested. I've got to route this to the right person. Here's a brand new order. Now, with this brand new order, I've got to kick off an intake. And generally that fax wrangler is responsible to go ahead and create the skeleton patient, the skeleton order. That means first name, last name, date of birth, hit save, new sales order, fill out a couple key fields like referral source, maybe the products, maybe the payer, maybe not if I can't select it yet. And then I'm going to put it in a WIP state and I'm going to assign that to the intake rep who's responsible. I'm also going to take those documents and I'm going to tag them to that order so that I've basically now filed the related documents. They're associated with the order. They're associated with the patient record. And now I can WIP or I can workflow that order to the next step in the phase, the intake phase. Now we get to intake and eligibility, where we're having to look over the documents that come through. We're having to completely enter that patient, completely enter that order, select the right insurance, make sure I check my eligibility. Hopefully I can do that electronically. Sometimes I've got to do a phone eligibility for certain payers to get the right information. But now I've got an order. I feel pretty good about it. It's got the insurance is eligible. Now I can decide, does it need to move on to the documentation step? For some companies and some product lines, it automatically goes to the documentation step. Like, it's a new ventilator order. Well, now there's going to be a documentation team that's going to look over that documentation and make sure that this patient actually qualifies to get a ventilator based on their insurance guidelines. If there's any missing information, that documentation team is going to be reaching out to my physicians and my referrals, trying to get that documentation back so I can proceed, get my authorization if one's required. So request that authorization, receive that back, and finally get that over to my scheduling or my dispatch team so they can go ahead and contact that patient, collect the copay, set the date and time, or invite them to come into the office, or kick off a dropship order from one of my dropship vendors, right? So that is sort of high level, the HME workflow. And hopefully, as you guys heard that resonated. I bet a lot of you, there's one person that does all these things, and that's fine. But as you grow and get larger, then you might have separate teams handling different aspects of this process. So now let's take a look at this in a different way. You'll notice here on the left side of my screen, I've got the workflow that we just covered. Now what I'm going to add on the right side of the screen are the systems. Okay. Now this is important. We now have to go through a little bit of a journey of understanding our systems and how our systems interact with our workflow. Now more than ever, this level of analysis is extremely important because we are in a situation where our costs and inflation are going up quite a bit, right? Especially labor costs are going up tremendously. At the same time, we've had a little bit of relief in reimbursement, but it's not keeping up with inflation. It's not keeping up with the rising costs. And so yet again, as an industry, we find ourselves in a situation with compressed margins, right? Where that margin is just being squeezed and squeezed and squeezed. And we're rapidly approaching a point where the only relief valve there is better technology, better systems, and really making sure that these systems are humming, really supporting my workflow with a goal of driving down my costs, driving down the amount of people it takes me to process orders, and driving up the quality of those orders so I'm not prone to as much human error, right? The whole goal is now to reduce my cost to collect, right? I have to pay whatever I'm paying today to collect $1. I need to pay less in the future. And the only ways I can do that is through workflow and systems, right? So as we look at these systems on the right side of the screen, I'm going to walk through these with you really quick. The first one there is your point of sale system. Now, some of you may not have all these systems. Some of you may have different systems. I encourage every one of you on this call to recreate this with your systems. Put your workflow on the left side, put your systems on the right side, and really think through those interactions between the workflow and the systems. The point of sale system is generally your retail sales system, right? That's what you handle in your storefront. When somebody just wants to buy something cash, they're not looking to bill insurance, collect that money and go, right? And as a revenue cycle person, I love cash sales. I love point of sale because my DSO on a cash sale is 0, right? I get paid the day that I dispense the product. I'm not waiting on anybody. I'm not going at risk for some insurance company. I'm not chasing down documentation. I've got the cash in hand. So go that route if you can, right? And that cuts off all the rest of this. Don't even worry about the rest of this. You got that. Now, unfortunately, we know that's not the case, right? People pay a lot of money to have health insurance. Health insurance covers our products generally. People want their health insurance to pay. So now we've got to deal with the rest of it. The next one there is your phone system. So your phone system, obviously, everybody has different phone systems, a lot of complexity there around phone systems. We've got some antiquated systems out there. We've got more modern IVR systems, VoIP systems, all that. Next, we have our eFax, our eFax capability, right? Do we have a separate vendor for that? Maybe we work with eFax, the original, or we work with RingCentral or some other product to handle our faxes. Hopefully we've got those faxes integrated with our billing system, although maybe we don't. Maybe those just deliver into an email. Maybe we still literally have a fax machine that sits there and prints. Hopefully that's not the case, but it certainly could be. Next, we have our e-referral system, right? So our e-referral system is things like DME scripts. That's the kind of the up and comer. It's got big investment behind it from AdaptHealth, VGM Group, Apria, several others, deeply investing in that DME scripts software. You've also got Parachute Health, Stratus, GoScripts, which is also called ePrescribe by Braintree. And another form of e-referral might be what's called direct secure messaging or DSM from your referrals like Epic or Cerner system, right? So they can sometimes send you an e-referral right out of Epic, right out of Cerner, and send that over to you. Next, we have the workflow system, and that is your billing system. So I know that's a little confusing. The workflow system is your billing system. I kind of think of them as being the same thing, but they could actually be two different systems in some providers with a separate workflow from their billing. Like for instance, maybe you're using Medforce's workflow platform, but you have some other software as your billing system. In that case, that's a whole separate bullet to look at in terms of this analysis. You've got the documentation or the document management side of things. That's your document imaging system. Hopefully that's integrated with your billing system. Sometimes it's not. We've also got your clearinghouse. That's where your claims go through. A lot of us here use Change Healthcare as our clearinghouse, or Capario. They acquired Capario. The other big one is called Waystar. They acquired Ability. So those are the two biggies. There's a few other clearinghouses as well that we sometimes interact with. We've got the insurance websites. So the UHC portal. You've also got portals like Availity, where you can access your Blues and some of your other payers. Another system is the source EMR. That could be Epic or Cerner or Athena or whatever it is that your referral source is using. It used to be in years past that if you were not a hospital affiliated provider, you would have no access to those systems. Nowadays, it's not as tight. Nowadays, there's actually ways to get into systems like Epic and Cerner, and for the health system to not expose all their data to you, but just the data for your patients that you guys are jointly managing. So that's something you could definitely explore. Having access to those systems can be crucial to your ability to timely get the documentation you need for authorizations and appeals and things like that. Next, you've got your calendar and your scheduling program, which is how you schedule your patients to get them out the door. Maybe you're scheduling your RTs to do your CPAP setups. Maybe you're using a system like Apacheta or some other system to do a mobile deliveries type solution. And then finally, you've got your drop ship vendors, which that could be like a VGM fulfillment, drop shipping your CPAP supplies. That could be like a McKesson or a Cardinal, one of those guys where you're not storing the inventory and you're going to have them ship that. So as you take a step back now, maybe many of us didn't even necessarily realize we had so many systems in play in managing our revenue cycle, right? So now we need to take this step of looking at each one of these and thinking about the interactions between the workflow and the systems. So that's what this next step is. And I will go through every one of them, but I will call out a few, right? So like, as I look at my phone queue and my walk-ins, what are the systems that support my phone queue and my walk-ins? Well, my point of sale system supports the retail aspect of that. My phone system obviously supports my phone queue. My workflow system is maybe where my insurance billable orders go, or maybe my point of sale is part of my workflow system. And then my document management, again, if I've got that insurance billable walk-in, then I'm going to be touching my workflow and my document system, because that's going to now need to flow into the rest of this workflow. So now as we go through each one of these, you can see the interactions between the workflow and the systems, right? So the fax railing, obviously the faxes are coming from the eFax solution. Also, we've got e-referrals coming into that same type of queue. Again, that's your air traffic controller for your new referrals, figuring out all these documents are coming in, all these referrals are coming in. Who do those need to go to? What needs to be discarded? What needs to be forwarded to somebody else? And what needs to be processed as a new order? And we move again into eligibility and intake. So I'm not going to again go through every one of these, but what I would tell you guys is every one of these interactions between a workflow step and a system requires its own standard operating procedure. It requires its own written procedures for how that system works, how that system interacts. How do we use it as a company? What is the my company way of managing this system, right? Because with any technology, there's 100 ways to accomplish the same thing. But as a company, we got to figure out our way that we want our people to do it. So there's consistency, and so that there's the data for reporting and managing that process. So as you go through this, you'll see again and again, lots of interactions between the workflow step and the different systems that we use. With document management, sometimes we have to call doctors. We got to use the phone system. Sometimes we've got to fax out requests. We need a process for doing that. Do we have a template for faxing out requests? Do we have an amount of time that we wait before we send the second request, before we send the third request, before we roll a rep to go out there and sit in the doctor's waiting room and try to get something signed? How does that interact with my workflow system? And at what point do I index things into the patient's chart, right? And I would say right away, I would say we don't want to print things if we can possibly avoid it, right? We shouldn't be printing. We should be saving to a PDF, saving to a file, uploading to document managing system, or uploading to document management. That way, if I'm out tomorrow, the person behind me can pick up right where I left off, see the same documents that I saw. They're not looking through my desk. They're not looking through my files. It's all right there, tied to the patient, tied to the order, ready to go. So as we go through this again and again, you can see so many different interactions between the workflow steps and the systems that we use to manage that workflow step. And finally, we get to the point where we see the whole picture. And it looks like somebody just took a pan of spaghetti, right? Just plopped it there on the floor. Boom, there it is. You've got about 40 lines there, 40 different, in this chart, points of interaction between your workflow and your systems. And again, remember what I said, every one of those lines represents an SOP, represents a procedure for how we manage that system. And as our company, what is our way for managing this process using this system? We need to ask ourselves, who administers? Do we know who's administering all these different systems? Hopefully we do. But a lot of times what happens is the person who set up the system is no longer with us, right? So we implemented our billing system 10 years ago. It was done by a totally different set of people than the people who work here today. Owner wasn't as involved, so they're really not too sure. And we don't know why certain decisions were made. We actually didn't keep up with the changes throughout time. So we're not taking advantage of new features and functions. And so we're all just kind of making do with a system we don't really like and not taking control. And that's our system. That's our workflow. And if it's not right, let's get the right system in there, right? This is a good time to also take a step back and say, is my system supporting my process? Is it supporting the growth that I'm looking to achieve? Is it easy to use, right? Is it supporting me? Or do I need to take some time now to reevaluate, maybe replace some of these systems with a better alternative? And again, do we have written SOPs? Written being the key word there, not lives in somebody's brain, because what happens is things happen, right? Things happen to people. When we rely on people to remember things, it's always a path to issues, right? I think we all would sort of agree with that. So we have to make sure that those SOPs are written. One thing I'll say really quick, you don't have to necessarily start a blank Word document and just start typing. Something Rhonda and I actually learned a few years ago from one of you, and this is great. We didn't learn it, but this is a great idea. So let's say I wanted to make an SOP for how to do whatever, how to post a cash batch. All I have to do is start up a Zoom or start up a Teams meeting as myself, by myself, share my screen, and hit record and transcribe. And that system will record all the things that I do. I can go through and do my work and talk through it as I go. The system will make the recording and make the transcription. A lot of you are finding a lot of success in doing that because let's face it, none of us has time to sit down and write SOPs, right? It's sort of the last thing we have time to do, but we have to do the work no matter what. So we can take a couple extra minutes, start that Teams or that Zoom meeting, share my screen, hit record and transcribe, and then go get the work done. And then I can now start to publish those videos and transcriptions for my team. And then they can go in, they can search, they can find where I said a certain word in my video and it'll jump, like, where did he say Medicare? It'll jump to minute 3 up. That's where he first said Medicare and start watching the video there. So they don't even have to watch the whole video to capture things because of that transcription. Very, very powerful technology. Okay. Now we're going to change gears a little bit. I know you're probably sick of hearing from me, and I think we all want to hear from Rhonda. So let's move over to Rhonda to talk about some of the questions we asked to really refine those SOPs we just wrote. Okay. And we're going to, again, go workflow wise. So we're going to start with the phone queue and the walk-ins.
Yes, thank you, Joey. And I'm so glad that you shared that experience that we had learned from one of the suppliers when we were out and about, because it was so cool. Like, we were in that aha moment, like, that is a cool idea. So I hope others take up that opportunity as well, because you can make it easy like that, or easier, I should say. But just with listening to Joey going through that whole process of the systems that we're involved in, when you deal with the hands-on as far as looking at each step and asking the questions, this is where it can help make your processes a little bit more efficient. So when we talk about phone queues or walk-ins, that's obviously your phone system, your point of sales. It's really looking at what you are offering that's matching your patient's needs. So looking at that from that high level view, and looking at your walk-ins also or how do you have it mixed as far as a retail experience and then an insurance experience? Those are two different situations. And I wouldn't recommend not having your insurance people, your insurance staff, handling your retail staff. If you can avoid that, I would avoid that, simply because when you have that insurance brain, that's what you automatically go to because that's what you know. So having two separate staffing or two separate experiences with those is important. So you really have to ask yourself, how do you handle those walk-ins? And then who understands an insurance coverage when it is a walk-in? So it's an immediate interaction with those patients. So when we go to that next slide on, I think it's fax wrangling.
That's right.
Yeah. Like Joey had said when you looked at the system slide, that's your e-fax, e-referrals, to be your billing workflow system, documentation management. So that fax wrangler, when you're looking at that role, that area, those are the folks where you're asking, how do you, like Joey said, steer those, you do the air traffic control as far as handling the documentation. So where are your initial referrals going to? Who is that first person that's going to get those? Or if it's since that someone's been waiting on, where do those go? How are they controlling those particular areas? Who are they fielding those to? One of the things you want to even ask yourself is, when you do receive those faxes in, and especially when it's an initial referral, or it could be even a resupply type order, a refill, you want to make sure that your referral sources know you received it. You don't want to assume that they know that you received it. It's important for them to know that the DME supplier did receive it, because we know how technology works. So who can you let know? Is it the salesperson that oversees that referral, or is there something that's an automatic response that can go back to those referrals and say, thank you for your order. We did receive it. We'll take care of your patient. Something to those effects. I know there's some suppliers that I've learned from by doing this that already do it. So should consider that. And then you also should always have someone overseeing that whole billing workflow system, with especially in the fax wrangler world. That is a busy job and a very important job, because you want to make sure that information gets directed to the right person so there's no delays and there's not any information missed. And then we have, the intake and eligibility. This is, I feel, even though like I said, your phones and your fax wrangling are important, but your intake and eligibility are so important. And one key thing you have to know is, where does that patient live at? Because you have to know if that's in your service area, so you know where to direct them from there. And then knowing the qualifications. How are your staff trained? Where can they find the qualifications? Is it a forms library type area that you can keep all this information that's easily accessible? I would have tried to avoid having printed criteria or qualification information because things change. Have them be able to get directed to websites or your company website that has all the information. How do you handle eligibility? Eligibility is so important to handle, as we know nowadays with the way patients' insurance hop. You need to verify their insurance and eligibility, not just take for granted what someone's telling you from a hospital or a clinic. Verify yourself. So who's handling that? Is that part of this process with intake, or do you have your separate eligibility group? And then also that eligibility comes looking at deductibles, copays, all that kind of stuff. And hopefully you're getting those credit cards on file. I feel like we've talked about that for years, and hopefully that's a normal process for most of you. If it's not, it should be. You should have a credit card on file. I think there's another slide with more questions. Yeah. And then just looking overall is one key thing I look at is, what can you automate? There is so much you can do with technology nowadays. What can you automate that will release your staff that you have to focus on some other key areas? And then taking that human interaction out that maybe could cause some error. So looking at where you can automate. So knowing what your software, your billing system, your documentation system has available, and using it to its fullest advantage is so important. So I would say you don't know what you don't know. So make sure that you get all that information you can from that system, from the company that you're getting your billing software documentation management from. Take advantage of the training and incorporating all of the tools that they have available into your own business.
That's right. And I'll just throw in really quick, automation is an area that's near and dear to us. We recognize that the days of giant reimbursement departments and huge call centers full of people are coming to an end in the not too distant future. And we really have to embrace technology in a much larger way. Something that a lot of people maybe don't know about Prochant is that we have a whole software department within our company. We have a full development team with a chief technology officer, product manager, lead engineer, about a dozen developers. So we've got a substantial development team. And what we've been developing over the years has been mostly for us to help us better manage our clients' businesses. But as we move and evolve, we're creating more and more products, and we're starting to go to the market with those products. And one of the things that's currently being developed, and this is a little bit of a teaser, is an automated intake management machine or engine that is able to automate a large portion of that intake process, from the data entry, the electronic eligibility, some simple qualifications, that criteria, routing, those kind of things, to really streamline that process, get those orders moving a lot quicker and into the right hands a lot faster. So that's just one example. There are several areas where you can automate within the intake team, not only data entry and things like eligibility, but there's even systems that like prior authorizations, where you can actually queue up and the system goes out, requests the authorization, follows up, brings it back in for you. So that technology is evolving, and I think that we're going to see more and more opportunities to automate, especially in this important area of our business. So I'll move on to the documentation slide, Ronda.
Yeah. So when you look at documentation, obviously that's another important piece of it. And that's your different systems with, as Joey shows on the screen, with your billing workflow system, your referral systems. You need to look at all your documentation that's been received, and do I have everything I need? And if I don't, do I have to contact that referral source for more information? And hopefully you can do that with one phone call, that you're not doing multiple phone calls with that referral. If you've been in those clinics, just as if we deal with in our own business, our phone's ringing off the hook all the time. And if we can eliminate that to alleviate some paid points for them, that would be helpful. And maybe it's your sales team contacting them if you haven't an internal sales team that's assigned to that account, or if it's an external sales team, the representative that can deal with that account to get the information, maybe they have a way to do that. And another great question is, should your referrals have access, or should you have access to the referral systems? Absolutely, you should. How can you gain access to their Epics and Cerners and to get the information that you need to help alleviate that interaction and letting them know, hey, if I have access, then I can pull the information I need. They can set up the system to where you have limited access and all you can do is pull in the documents that you're needing, that you don't have 100% access like they do. And then obviously organizing your team. How is it organized? I should say, is it by the type of referral that you're getting? Is it by a payer? Is it by a pod? I'm a fan of pods, especially Joey talked earlier about having maybe a sleep pod or a respiratory pod, or maybe it's in supplies, a supply pod, or maybe it's by payer. But having those pods, I've seen that very successful with DME suppliers. I understand that depending on the size, how that can be handled. If you're a smaller scale company, it might be a little bit tougher. But if you can make a pod to have them be experts in that area, they will truly be experts in that area. And it's pretty cool to see that happen and see them grow with that. So those are some great questions. I think we have just one or two more.
Yeah, we do.
Yeah. Prior auths, our favorite topic sometimes is prior auth. Obtaining that initial prior auth is obviously important, and a lot of times we can capture that. But where we miss it out is what payers do still require prior auth. Those change often, and making sure that's communicated to the appropriate people. And also, how long does that prior auth last? Is it good for just a month, a few months, 3 months? You have to know the length of need on that prior authorization to be able to do a reauthorization. And knowing if they do a stat prior auth is so important. So you have to ask those questions. If there's a way you can handle or incorporate some kind of cheat sheet for your staff, so your major payers who requires a prior auth on what products, so that you can easily have your staff glance at that. You can set it in your system somehow where there's stops to say this requires a prior auth, so so the staff knows to capture that.
That's right.
Yeah. And then we have our scheduling and dispatching. This is important in the sense as how we're going to get that equipment to the patient if we have to go and deliver it, or if we have to schedule time for them to come in and spend with a clinician. There's only a few. I feel like it's pretty limited on the software or the systems that are available. But you should always ask that patient if they or someone can come in and pick that product up in your store. That's always the first, I would think, first line is, when can you come and pick it up? It's how you phrase those questions. You can certainly, if you can drop ship something, and certainly can consider that and send maybe that paperwork that they need to sign off on electronically. That's a good way to capture their email or some other contact information to promote your business, your offerings to them. And I know on call it can be kind of tricky, but it's important to have a process for your on call or after hours staff so they know how to handle, especially certain product categories that require some specific attention, maybe in the respiratory world, like who's going to handle looking at those qualifications. But you want to make sure that you have the appropriate staff in place to be able to handle the on-call after hours, looking at documentation. It's not just about getting that call and setting somebody up with oxygen or a respiratory product. You need to look and make sure that you're protecting your business with that coverage criteria. So it's pretty important. And when Joey mentioned earlier, the proof of delivery types, I call proof of delivery type systems like the Apichettas and whatever else is out there. Those are pretty cool to see because it's so instant, it's so automatic that you don't have the delay in the paperwork or the delay in the process, that things can keep moving pretty quickly. So if that's something you can incorporate, you should certainly consider it. It is worthwhile.
Yeah. And a couple thoughts. One is dropship, as we're mentioning here. With the dropship order, again, that's a situation where you don't have the product on stock. Your vendor does. And that could be VGM Fulfillment, that could be McKesson, somebody like that. So they're going to ship from their warehouse, right? And they're going to send you a tracking number. Now, the important thing is that tracking number is not your proof of delivery. That's my point I want to make. That tracking number is not your proof of delivery. We have to recognize those tracking numbers get reused. They get recycled by the shippers. So if you wait 6 months and then you finally go track that tracking number, it might very well have some other shipment details tied to it. So it's important when you get that drop ship confirmation back, that you go ahead and track that package and capture the page from FedEx or UPS or whoever that shows it was delivered. It was delivered to this address. That is your proof of delivery. A lot of your vendors will capture that for you. So it's important. I'm not saying like every single one of these orders, you're going to have to go run the tracking number and then print to PDF and upload. You might for some, but for others, just make sure that they are capturing that proof of delivery for you and that you're going to be able to access it if and when you need it. Okay.
Absolutely.
A couple other things that you said, Rhonda, that struck a chord. So in the last slide, we talked about authorizations, and it said, what do we do if it's a stat or a discharge? What do you recommend, Rhonda? Well, I have an order, it requires an auth, but the hospital wants this discharge out the door in 2 hours.
I would make sure I knew if I could get what we call emergency auth for that product. And the example I think of is, I know there's some states that do like an emergency auth for some respiratory products. When I was a supplier, remember oxygen was one of those. With like Medicaids, they require a prior auth for oxygen. So we knew we could get an emergency auth for that oxygen patient. So we can call. I'm sure now that, because this is many years ago, we had to call, but I'm sure you can do a lot of things online. But you can get an emergency auth, and that auth would be good for a month. So you knew right away that was going to be approved for at least a month. And if it didn't, if you didn't have all the information you needed beyond that first month, then you had time to gather it all. So I would make sure that I knew that what payers do emergency auths and what that time frame is, and how can you submit for emergency auth? Is it calling? Is it on one of their systems that you can go in and just plug in information and you get that authorization? So that's the best case scenario. If they don't offer an emergency auth, but they do require prior auth, I would contact the patient or their family and say, listen, your insurance requires a prior auth in order for us to know that they'll cover it. So this is what we can do, and let them know what your options are. We can go ahead and set you up, but we're going to have you sign some kind of financial waiver of liability that says that you may be responsible if this prior auth doesn't get approved when we submit it, or we can wait for the prior auth. So I would leave that onto the patient for them to decide, or their family, if it has to be done.
I agree with that, definitely. Sometimes we have our procedure that says we need an auth before we deliver, but as we all know, things happen. So making sure that's again what I was saying, you map out the happy path, and then we miss out the weird things that just end up happening that we have to be able to deal with. And we have to be able to deal with this in our workflow because it happens every day. So do we have a method of getting that, informing the patient in advance? Your item does require an authorization. We do believe it's going to take a few days to get that authorization. Your doctor has requested that we provide the equipment today. So here's the deal, right? Like, we're going to give it to you, and we're going to make you sign something that says, if the authorization falls through, you will either return this equipment or you will pay for it. And maybe we even put a credit card on file right then that we can charge in the case where they're going to keep the equipment.
Yeah.
So
you got to protect your business. I know we're all caregivers and we want to help, which is obvious. I'm not saying that's wrong or don't do that. You want to, but it's a business, and if you don't cover your business in that aspect, it can detrimental, as we know, like Joey had already talked about, with the reimbursement rates and with issues with the inflation. So it's important to protect your business, and ultimately it is the patient's decision, to let the patient decide. So
that's right.
Yep.
And then one last thing I want to say before we go to our summary slide is, you said something that struck a chord with me in this slide, which is it's all about how you ask the question when it comes to pickup or delivery. And I would say in this front office process, to me, there's 3 like inflection points where asking the question the right way makes all the difference. So the first one is, a patient walks into your showroom. That's it. A patient walks into your showroom. How do we approach that patient? If you have a reimbursement person working the floor, in their mind, immediately they're assuming this patient has a prescription and they're going to want to bill their insurance for whatever it is that they're looking for. It changes the whole conversation. Whereas if in my mind, my assumption is they walked into my retail showroom because they're going to spend some money. They're going to buy some stuff. And I'm going to sell it like that. That's the first sort of inflection point. It's not, will you be billing insurance for this item? But how will you be paying for this item? Or those kind of things, right? So, and also along the same train of thought is, you can have a formulary as a business, which says, These are the makes and models. These are the parts that we are willing to provide for each of our insurance contracts. This is what we would consider in contract. So they want the super high-end rollator that you've got with all the bells and whistles, and it's got the sparkles and it's got whatever. Well, that's not on the formulary. So that's going to be a cash sale. So that also is a concept we need to have, that on our showroom floor, we may have the insurance billable stuff, but we may also have some upsell items there that, I mean, hey, you can get the standard walker, the basic walker, and that'll be covered, or you can get this fancy one, but it is going to be a cash sale. And a lot of times you'll get that cash sale. The second inflection point is when you've got to collect money up front for something, right? The question is not, can you make a payment right now? It's, will that be Visa, American Express, or Discover card, right?
No.
That's the question. You have to pay. Nobody's going to let you walk through the checkout line at Walmart and say, bill me, right? Now, I'm not calling you guys Walmart, but that's how we're all trained, right? You pay for something. When you get a product or service, you pay for it. When you go to the doctor, one of the first things they do is make you pay. So here, your only point of leverage with your patient is your product or service. You cannot give that away until you have some monetary thing in place, right? And so that's really important when we ask that question. It's not, can you pay up front? It's, will that be American Express, Visa, or MasterCard? Finally, it's here when it comes to, I'm scheduling the patient and the way I present the question. It's not, when can we come out to your house? The only products that we should be thinking in our mind, we're going to have to roll a truck, is a lift chair, a hospital bed, maybe a power chair, those big items that people generally just can't come pick up from your store. But otherwise, we should sort of assume people are just going to come pick stuff up from us. So that's the way we present that question is, oh, will you be able to come by on this day or this day to pick it up? Don't offer rolling a truck until they bring it up. Let them bring it up. In other words, unless it's one of those items that we as our procedure, we deliver those items. Okay, I'll get off my soapbox now and we'll move on to our summary. So I told you guys what I was going to tell you at the beginning, here at the end. So how do you optimize your intake team for success? Number one, you structure your team for success. You make sure that you're structured the right way based on the size of your company, your order volume in terms of payer and product mix, geographic mix. You put all that into play. You've also hiring good people. You're hiring A players to be on the team, people that are core value fit. They have the right attitude. You can train them in the skills. So that's number one, structure that team for success. Number two, get a grip on your workflow and your systems. Again, understanding that workflow deeply, like we did, understanding those systems deeply, and then really in analyzing those interactions between the workflow step and the systems and making sure that I have written standard operating procedures for each one of those interactions. And finally, how do I optimize my intake team? I refine my SOPs by asking the tough questions. Some of the questions that Rhonda took us through today to make sure that when I outlined the process, I didn't just outline the happy path. I outlined most of the other paths as well, so that my team will be able to handle exceptions as they come up and won't have to come bother me or just make it up as they go along. So that's how we do it. That's how we optimize an intake team. I really appreciate you guys taking the time to meet with us today. We got some great questions. I know we've only got about a minute left. So I'll answer the first question. The other ones, we will send written responses to you guys. The first question was, can you say that again about SOPs through teams? Okay, so here's what I say, SOPs through teams. So you need to make an SOP for, let's say, how to work a certain type of denial. And by the way, you've got a bunch of those denials you need to work. So here's what you do. You work them. You go ahead, pull it up on your screen, get the work up on the screen, then start a Teams meeting. Like start a new meeting button. The Teams box comes up, hit the share my screen button, then also hit the button that says record and transcribe. Make sure you get the and transcribe in there. Record and transcribe. Make sure you're talking into a microphone at the same time. So you can be the only one in this meeting and that's fine. It's going to get recorded. And so what will happen is what gets recorded is your voice plus your screen. And it's also going to get transcribed by the system. And then simply do the work. Do 2 or 3 work examples before you stop the recording and talk your way through it as you go. So in this method of creating SOPs, you're doing the work, which you need to do anyways, while you're simultaneously having the SOP write itself by the team system using that recording and that transcription. And then once you've got that, you can save those recordings and transcriptions in a common folder, and it'll be searchable. So there's a Microsoft app. There's also a Google app. It'll be searchable. Not only the transcription will be searchable, but it will tell them at what time in the video did you say that word? My example was Medicare. So it'll tell me at minute 3 is the first time you said Medicare. So they can start the video, jump to minute 3 and see exactly what I said about Medicare. So that's what we were saying about using Teams or Zoom or one of these other systems to create your SOPs.
Well, and just to add to that, into that answer there, is the great thing about when you're recording yourself doing it and it's transcribing it is depends on what type of learner you have. Some people are better at visually, some people are better at reading something. And if you can visually see something and how it's done, they're going to learn it a lot quicker, right? So why not do it in that method? And it's quicker and easier for that person. So when you have to sit up there and read instructions and then go and try and figure it out through your own system, it can be a little bit more challenging. I feel like if that's not your method of learning. So it's really cool to have SOP that way.
Yeah.
Which we just described.
Great.
Yeah.
It's not just a backdoor method of making SOPs. It's actually a really good method because modern learners like Gen Z and all, like, they love videos and they love short little snippets and stuff. They're not going to go dive into a 100-page SOP and try to find the answer.
Yeah. How many of us go to YouTube and look something up for how to? So
Great.
Yeah.
Great.
Yep. So a lot of
All
good.
right, Chuck.
Great.
All right, everybody, thank you so much for being here today. And thank you to everyone who's listening to the replay right now. If you have any questions about these, you can always email joeyg@prochant.com or Ronda.Buhrmester@vgm.com. And if you're listening in, we'll have that in the show notes so it's easy for you to find. Again, thank you everyone who asked questions. We will be reaching out directly to answer your questions following this recording. Again, the recording will be made available to everybody who signed up. So if this is something that you found meaningful and you got, oh, well, so-and-so on my team needs to see it, please fill out the registration form again and put their email, and they will receive a copy of the replay so you don't have to remember to forward it to them. If you are listening to this on our podcast, please read us 5 stars on Apple Podcasts. And if you're listening on YouTube, please give the like and the thumbs up and subscribe and all that good stuff, so more people will find these episodes. Again, I want to thank Ronda for joining us today and for VGM Group for being an amazing partner to work with, amazing association. Joey, thank you so much as always for sharing your expertise with us. We will see you all again on the next episode. Thanks so much for listening. Take care.
Thanks for listening to the Modern Healthcare Back Office, a presentation of Prochant, a wholly owned revenue cycle management service dedicated to serving HME, pharmacy, infusion, and other healthcare providers. Learn more about us at prochant.com.